So cataract surgery's been around for quite a while, and it's getting better and better, obviously with the advent of the laser surgery. What is the difference between LASIK, which we've heard about for correction, LASIK surgery, and cataract surgery?
You know, a lot of people are familiar with LASIK surgery. It's been advertised, it's been around for quite a while. Well, so has cataract surgery. But the difference is, LASIK surgery is so well known because people were getting it done with a laser, and it was a new thing in eye care at the time. And LASIK surgery is really a reshaping of the lens, or actually the cornea, which is the front of the eye. And if you go back to our eye model, that's the front up here. What they do is they actually reshape the surface with a laser. It burns away a portion of it, and then they cover it with a flap so that it doesn't hurt. And this corrects the vision similar to what a contact or a pair of glasses would do. With cataract surgery, we're removing the lens of the eye that's become cloudy. So we're not so interested in reshaping up here as replacing this lens with something clear. And when we do that, we now have the option of putting the patient's prescription permanently in the eye.
And why wouldn't you want to, if you can use the laser out here, now this revolutionary new way to use the laser inside? I can't imagine the precision.
Absolutely. You know, we all think of LASIK surgery, we hear laser surgery. And if someone said, well, I'm going to do your LASIK surgery with a blade, well, I'd be a little surprised, and I think you would too, and so would our audience. And my patients, when we talk about cataract surgery, naturally assume it's done with a laser. But what they don't realize is the standard of care and the standard way of doing it across the U.S. and currently here in Boise, until we brought on this new technology, was to do it with blades.
These tiny blades.
That's right, and we have some of these here for display. And what the blades were used for was to open the eye, and blades like this, there's 3 different blades, and it makes between 2 and 3 different incisions that are 2.5 to 3 millimeters in size. And they were used to cut out the lens and then replace it with a new one. Well, now we have the ability to do that all with a laser. And so when patients ask, do you do cataract surgery with a laser as well? I say, absolutely we do. And it's even more precise than LASIK surgery.
Wow.
We have technology that is much newer than the technology used for LASIK surgery.
So that's got to be an important thing. If I'm going to have someone operate on my eyes, what am I going to look for in a surgeon? What are your patients after?
You know, patients hear a diagnosis like cataracts or another eye disease, and that's, you know, it takes a while to process that. And when they're with their eye care professional, whether it's their optometrist or ophthalmologist, you know, they have a minute to process, and then the professional will usually say, what other questions do you have? Well, patients don't know what to ask. They're still processing the diagnosis. And so I find there's a few common things that patients tend to want to know after they've had time to think about it. And what I think are really, really good questions they should be asking. And most of them revolve around their comfort and knowledge of the procedure. And so when they're being referred to a surgeon like myself for eye surgery, especially for cataract surgery, they need to ask the referring doctor, well, who are you sending me to? And do you trust them, and do they have good outcomes? And the patient needs to make sure that they're comfortable with that doctor. When they meet with the surgeon, they need to be able to have a rapport and a conversation. If they feel like they're not heard, or if they can't understand the explanations given, they may not be a good fit. You know, studies actually show that patients that can actually communicate with their doctors have better outcomes. Now, it doesn't change the way the doctor does a surgery, but it gives the doctor more information, and it gives the patient trust and the ability to heal better.
Well, that makes sense.
A second question that they should ask, and patients need to understand that they can ask these questions, is how do you do the surgery? Are you still using the old blades, or are you doing it with a laser? Are you using new technology? And that's a legitimate question. And doctors will be honest, they're not going to lie, but if a patient feels that, you know, they're not understanding, if the answer isn't an obvious yes, well, it's probably no. It means they're probably doing it the standard way with the old blades. And lastly, and I think this is really important, a patient needs to know who's going to take care of them after surgery. You know, patients are referred to a surgeon, and they have a surgery, and sometimes they stay with that surgeon, and sometimes they go back to the referring doctor. But if there's a complication, the surgeon who is there should be available to take care of them.
Definitely.
And what they need to make sure is that that surgeon is going to be around for them if things don't go as planned, or if something needs to be addressed down the road.
And you're here through the whole cycle, from diagnosis to getting referred to doing the surgery to the post-care.
That's right. I'm an Idahoan at heart. I was born here. I was raised here. I practice here. And so I live in the same town as the patients who I take care of. And I run into them on the street, and I see them every day in my practice. And I'm here for them throughout the entire process, during surgery, as well as post-op. Now, I do work with a lot of the referring doctors in the area, and they'll send me their patients, and if the patient's comfortable with their doctor, after the surgery's done, I'll have them go back there. But I'm always available to see that patient.
That is so reassuring. And is there anything more important than your eyesight?
You know, I think it's probably the most precious sense that we possess.
Yeah. Well, before I let you go, I want to hear what else you do at Vision Quest. What other services do you provide there?
You know, I'm a comprehensive ophthalmologist, and we provide what's called comprehensive ophthalmology. Now, my specialty is cataract surgery, but when I do surgery on the eye, if there's something else that needs done, I can do it at the same time. Specifically, a combination surgery that includes a surgery for something called glaucoma goes well hand in hand with cataract surgery. When I'm inside the eye working, I can do a little procedure that actually lowers the pressure in the eye, which is what our goal is with glaucoma. So for patients who have both cataracts and glaucoma, we can do two things at once, and it's more convenient for the patients. They really end up with not only better vision, but less need for eye drops if they've been on eye drops for glaucoma.
Oh, fabulous. And you have a couple of optometrists in your practice as well. How do you all work together?
That's right. I have several optometrists in my practice that see patients for primary eye care needs, to check glasses and contacts, to follow up on regular eye health. But when it comes time for surgery or anything complex in the medical realm, I'm always there to consult, and they refer to me. Typically, these patients will go back to my optometrist.
All right. Well, you have been a wealth of information, and it's so exciting for Boise to finally have this advance, the only place where people can get laser cataract surgery now, and you call it the latest and greatest.
That's right. This is the latest and greatest in cataract surgery. Now since the laser, though, there's been addition of more technology, something that we call the aura, which is intraoperative aberrometry. And I'm glad you bring this up, because what it is, in the past, we would measure someone's eyeball, and we would try to figure out what type of lens to put in. So we remove the old lens and put a new one in. Well, a lot of times, we were close, but we weren't right on. Patients still needed glasses for their best vision.
And you probably wouldn't know until they were out of surgery.
That's right.
And you measured them?
That's right. We would put a lens in and cross our fingers and hope for the best. And the next day when they're looking, they'd say, well, it's not clear. And that little device that, you say better 1 or 2 that everyone loves, suddenly it's better at 2 and not 1. And we realized we didn't hit the mark. And that's what's called a refractive surprise. Now we have the ability during surgery to get that cataract out and remeasure and see what the patient's true prescription is. I can then put in a lens and align it, which allows me to pretty much leave their prescription at 0 and verify it.
So it takes all the guesswork
That's
out
right.
of it, the art
so,
of it.
So we're getting rid of the surprise. And so next day, there's not this better 1 or 2. Patients are happy, they're ecstatic, they're seeing better than they've ever seen before.
That's an exciting industry to be in now, in the medical field, doing eyes. So much technology.
That's right, and it's been stagnant for so many years, but in the past decade, so many advancements have been made. There's really no better time to have eye surgery than right now.
All right, well, thank you. I feel reassured by everything that I've heard, and it's exciting to know that we don't have to go to a big city. We have the high-end technology here in Boise to improve people's vision.
It doesn't get any better than this, right here in Boise.
Well, thank you so much for being with us and sharing the good news with the Boise Valley about laser cataract surgery.